Hi, Steve from Wandsworth Physiotherapy and Osteopathy. So we see a lot of people with ankle sprains here in the clinic. Now this can be people playing sports, particularly multi-directional sports such as football or netball, or people simply going out for a run, tripping on a tree root, or even just walking down the pavement. You hit an unstable paving slab and then you go over on your ankle. So most commonly we do an inversion sprain, and it's these outer side of the ankle ligaments that get injured. And there's some key ligaments that will commonly get injured. We have the anterior talofibular ligament, ATFL. This is the most commonly injured ligament when we're thinking about ankle ligament sprains, followed by the calcaneofibular ligament, CFL, and then lastly the AITFL, the anterior tibiofibular ligament. Anterior inferior tibiofibular ligament, sorry. And this can be a bit more of a problematic injury because it's one of the main stabilizers of the ankle, and it might need some surgical intervention. But the other ligament injuries can typically be managed with physiotherapy management. Less commonly, we get injuries to the deltoid ligament complexes, which is on the inside of the ankle. Now, when we have this inversion sprain, we don't typically sprain these ligaments, but we typically crush them as the bones bang together. You can also get bony bruising on some of the bones on this inner part of the ankle. Now, when we think about classifying these injuries, there's debate amongst the professionals about how we classify them, but to keep it really simple, I just tend to stick to mild, moderate, severe, grade 1, 2, 3. So a grade 1 injury is minor. There'll be some bruising or swelling. You can probably usually walk on it within a few days, and it should resolve over maybe a few weeks to a month. A grade 2 injury, a bit more significant, more bruising, more swelling, more difficult to walk on over the course of a week, probably will resolve in 6 to 8 weeks. And a more severe injury or a total rupture, significant bruising, swelling, probably not going to be able to walk on it properly for 2 or 3 weeks, and in this case you might need to go into an air cast boot and wear and use crutches for a couple of weeks. And that would be the management of it, alongside seeing a physio to get the ankle moving, have mobilization exercises, strength exercises, and then be guided back into your sport or daily activities. Now, there are a couple of complications that can occur with ankle sprains. And if it's not sort of following a normal healing pattern or resolving over 4-6 weeks perhaps, there's maybe a couple of other things that we might need to start looking into. And one of these injuries that can occur is, particularly in people that recurrently sprain their ankle, is an osteochondral defect of the talus, the bone in the middle of the ankle joint. So this is quite a unique bone, as most of its surface is covered in a thin layer of cartilage, and it doesn't have any muscle or tendon attachments. And if we keep spraining that ankle, we can scuff off and create a little hole in the cartilage on the top of the talus here. Now we can pick that up on an MRI, and this is the sort of injury where it's not quite resolving, it's maybe still a bit swollen 6 weeks later. Now we could manage this with injection therapy, steroid to settle swelling, hyaluronic acid, or perhaps even PRP can potentially help with that osteochondral defect. But if it's something that's persisting longer term, then it may need a surgical intervention. Now, a couple of other complications from ankle sprains are impingement type symptoms. Now we can get a bony or a soft tissue impingement that occurs in the ankle joint after ankle sprains. It's probably more common to see a soft tissue ankle impingement, and this is because the area that was injured is thickened, the ligament tissue is thickened, the synovial lining of the joint capsule can be a little bit thickened, there can be some synovitis in there, and this can lead to persistent ankle pain. So particularly when you're going to that knee over toes movement, walking up or down stairs or walking uphill, for example. And if we flick your foot into this dorsiflex position, it gives you some anterior lateral pain. We may be thinking it's anterior lateral soft tissue impingement. and this can respond at that stage nicely to an ultrasound guided steroid injection, which we can do here at the clinic. And you may also then be getting some bony impingement where there's some osteophyte development around the edge of the tibia, and that might be causing the impingement. Again, we might be able to calm this down with a steroid injection, but if it's persisting longer term, again, you might need a surgical opinion on that. And then lastly, we can get posterior impingement at the back of the ankle. Now this typically happens when the injury was also with toes down or plantar flexion, and you pinch some of the tissues in the back of the ankle joint. Now again, we can get soft tissue impingement at the back of the ankle joint, which might respond quite nicely to an ultrasound guided steroid injection, or you can get a little bony protuberance on the back of the talus here, it's called an ostrigonum, and that can also start getting impinged into the back of the ankle joint. And when we do a test on you where we flick your foot down, it causes that pinching in the back of the ankle joint. That's giving you symptoms. We're starting to think about posterior impingement and how we might be able to manage it. So if you've suffered an ankle sprain and you want to get it managed, treated with some physiotherapy and guided back into your sport, come down and see us. We'll get one of the team to assess you and guide you through that process. Similarly, if you've had an ankle sprain recently and it's maybe 4 or 6 weeks later and it's not following that normal course of healing, it's perhaps still a little bit painful or even swollen, then come down, we can give you an ultrasound scan and just see why that might be the case, if there's any ligaments that are particularly injured, and maybe give you an ultrasound guided intervention, or be guiding you on then if we think you might need to have an MRI or see one of our foot and ankle surgeon colleagues for any other intervention that might be required.